Hello everyone, I am Dr. Chirag Chamria and today I would like to talk to you about bone grafting in the upper jaw. A lot of patients come to us and they are very knowledgeable, well read, and they say, Doc, I have a missing tooth in the upper jaw and I want a sinus lift. And then we go across and explain the advantages, disadvantages, what to do, what needs to be taken care of. Do you really require a sinus lift or not? So this talk is dedicated to maxillary or the upper jaw bone grafting in relation to sinus lift. Right? So see what happens as soon as you lose bone. As soon as you lose the tooth, we start losing bone. This is a natural phenomenon of the body. Now as soon as we start losing bone, we are now not able to restore that particular area by use of dental implants. Because dental implants take anchorage from the bone. Now if you want to take anchorage from the bone, we will have to add bone over there, and that is the whole idea of doing a sinus lift. So there are 3 to 4 factors which you need to consider before going ahead for doing sinus lift. First and foremost, do I require that much amount of bone for my implant? If I do require, how much is that bone which I require? Can I place a regular implant? Can I place a tilted implant? Can I do zygomatic implant? If I can, I would prefer going there because the success rates are over 90% in 5 to 10 years. For sinus lifts, the success rate is less than 88% in a 5 to 10 year period. It also involves a surgery. The next factor which I would like to consider is the number of times which the surgery is going to be done. In a sinus lift, I will require minimum 3 surgeries. 1 to place the bone, 2nd to place the implant, and 3rd to restore the implant. Whereas in cases where if I can incorporate all these 3 in one, or can I use an alternate technique? Next, we would like to understand is in terms of bone grafting, what type of material are you going to use for bone grafting? See, fundamentally you can have synthetic, you can have animal origin, you can have human origin, and you can have your own bone grafts. The best is using autogenous bone grafts, that is your own bone grafts. But that means we will require surgery to be done at 2 places. One from where the bone graft is taken and one where the bone graft will be placed. Although it has the highest success rate, when compared with the other 3, that is the synthetic bone or animal origin or other human origin bone, the success rates are still lower in a 5-year period. So what should be done in this case when I am thinking of bone grafting? Now there are a lot of studies which are done which states that why these bone grafts have such a low success rate in dentistry when else in the even in maxillofacial surgery or in orthopedic these bone grafts work well. Certain factors are not considered. One of the most important factors is the placement of the dental implant in the bone. How will the load transfer to the bone through the dental implant? Second, what is the type of tooth which we are going to use to restore that dental implant? All of these come under the occlusion. Fundamentally, the occlusion over a sinus lifted dental implant prosthesis, that means the artificial tooth which we have placed over a dental implant in the grafted region, should have a very simple occlusion in the long axis of that implant, which means that if this is the implant, there should not be any lateral forces acting on it. It should be exactly straight. Then the success rate of your bone graft of your procedure is very high. Second, reducing the amount of load on this implant. Now how do you reduce the load? There are 2 ways. Either we use our knowledge of geometry, that is by placing 2 implants and having a bridge, or we angulate the implants in different directions. Placing more number of implants in different directions would help reducing load on each implant, because your bone graft is going to be weaker than your native bone in that area for at least 1 to 2 years. Then over time this bone graft will take up properties of the native area and have those stress lines in direction to what your body requires. But till then we have to protect that bone. Hence, using different techniques of placing dental implants helps. Using new age dental implants, using alternate materials for dental implants would also help. Using SAPTeeth technology over the dental implants, which means now we know that our SAPTeeth, which is HIPC or similar products, will reduce the amount of load going to the bone by 96%, which means that if I restore and use the artificial tooth material as SAPTeeth, I am going to reduce the amount of load which goes on the implant, and hence I am going to reduce the load on the bone as well. Therefore, avoiding the use of zirconias and metals and ceramics in such cases will be highly advantageous and give you much higher success. When we place an implant in multiple directions, we got to make sure that the healing also happens in those multi-directional areas. Hence, use of splinting techniques. Splinting means that we actually fix the implant in that area with the use of neighboring tooth or neighboring implants so that they do not move in any of the 3 dimensions. This also helps in having a higher success rate. Hence, dental implants and surgery are one aspect of the sinus lift, but I think majority aspect is how you will restore it at the end of the day. Therefore, the right question to ask is not, do I require sinus lift or not? The right question to ask is, how do we restore this missing tooth, even if I have less bone? Thank you.